in the morning, presented by First Commonwealth Bank here on WCCS, AM 1160 and FM 101.1. You talk about a guy that's making all kinds of people turn their heads. It's this guy. Dr. Yousuf Qureshi is with us this morning. Dermatologist comes to town, and you found a lot of business around these parts, haven't you?
Yes, I have.
Yeah. Now, you've been here for how long now?
I've been here it's my 6th month now.
Yeah. Wow, it's been that long.
Yeah.
Wow. All right. IRMC Physician Group, of course, Dr. Qureshi involved with them, and you have an event coming up later this month you want to tell folks about.
Yes, I do. It's a talk I'm giving on January 23rd, which is a Tuesday, at 6 p.m., and the title of the talk is New Year, New You, and I'll be talking mainly about cosmetic dermatology, which is a field I found that a lot of the patients who come in to see me aren't too familiar with, and I'll be mainly talking about kind of what the field can offer patients, ranging from completely non-invasive things such as getting on a skincare regimen, adequate sun protection from photoaging, all the way to more minimally invasive procedures that we offer in the clinic to help rejuvenate the facial skin.
Well, getting that skin back in shape is something that is easy to neglect, and I find that a lot of people do, including me, as you know. But it's something that is absolutely vital, and for a number of reasons.
Yes. A lot of people focus on the cosmetic aspect of, taking good care of your skin, but it offers many other benefits too, including the main one, which is prevention of skin cancer and other growths on the face. But really, if you take good care of your face, you'll both protect yourself from the dangers of skin cancer, but also from the unpleasant aspect of aging, which is induced by ultraviolet light.
Give us a little better idea of what minimally invasive procedures you'll be talking about.
So mainly I'll be talking about Botox, which is a neuromodulator, and that can really make a big difference for fine lines, wrinkles, and kind of improving the overall tone of your face. I'll also be talking about dermal fillers, which are used again for the fine lines and wrinkles, but also can help deeper lines and wrinkles and restore volume that we lose over time. With time, we kind of lose some fat in our face, and we also have osteoporosis of our facial bones, just like we do with the rest of our bones. And so that can create a sunken appearance, a kind of more aged look, and we can restore the youthful look in a lot of cases with dermal fillers. Yeah. And the other thing I'll be talking about is Kybella, which is a submental fat treatment for the quote double chin people have, and we can do things for that as well. And then we also offer microneedling and chemical peels, which are more targeted for scarring and the improved tone and texture of the skin.
Now, when you say minimally invasive, that sort of implies that there would be a quicker recovery time, that the procedure would not be something that would cause you to lose substantial time at work or through the course of your day, not alter your lifestyle all that much. Is that basically the case?
Correct. So the downtime with a lot of these procedures is very minimal, and that's a big plus for a lot of people who want to get procedures done and kind of look refreshed, but don't want people to know about it. That they have something drastic done.
Okay, so this is coming up January 23rd. Is it necessary for folks to pre-register?
Yes, we are recommending that you call ahead to reserve your seat, and you can do that at the phone number 724-357-8088.
Okay, very, very good. When you do presentations such as this, and I don't know that you've done a lot of them in this area, but I know that you have in other areas, the reaction that you get from people who might have thought to themselves, this is the way my face is, this is the way it's going to be, that's part of the natural aging process. When you show them what they can do to restore that youthful, the phrase is always the youthful glow, when you can restore them to a better skin condition, I would guess that you hear some pretty shocked gasps at some of these events when people realize what's out there for them now.
Yes, that's absolutely correct. The field of cosmetic dermatology is growing at a pretty rapid pace, and there's a lot of things we can do with minimally invasive technology that make a big impact on the way people look. So people are always surprised, and I've always had very good feedback at these talks because people tend to learn a lot.
Yeah, I bet you there's a pretty big psychological benefit to getting that youthful restoration as well.
There is, and there's been kind of newer research data out there that really looks into the biofeedback of a lot of these procedures we do to restore, the youthful look and how it can change our mood as well.
Dr. Yousuf Qureshi is with us, the IRMC physician group. He's a dermatologist who will be presenting this program. Did you say where the event is going to be held?
It is at the Park Inn by the Radisson.
Oh, okay.
By Radisson, yeah.
Here in Indiana.
Yes.
Okay, 357-8088 is the number to call to reserve a spot. You've talked about a couple of different procedures and methods by which you can treat skin. Is the field changing all that much? In other medical disciplines, we hear that, radical changes come in seemingly endless waves. In your field of dermatology, are there that many changes that come frequently and can really represent a real change in the way that you're able to treat patients?
Absolutely. And that's why I do highly recommend going to a dermatologist for these types of procedures, because they are really familiar with the latest technology out there. And there's been, many developments specifically in the field of ultrasound with microfocused ultrasound and radio frequency devices that can tighten the skin. That's been kind of really developed in the past couple of years, which is new. Botox and fillers have been around a long time, but there are newer formulations of the botulinum toxin, and there are newer dermal fillers out there that are becoming FDA approved. So, a dermatologist is the person that really kind of knows the most up-to-date information about this and can find the right procedure and the right product for you.
You talked about non-invasive, minimally invasive. Talk about the types of things that you'll be discussing that night that really are completely non-invasive and things that people can do. Yeah,
I get a lot of patients who come in for the minimally invasive things, and I end up having to educate them about doing non-invasive things, because I always, tell patients, if you're going to spend the time and the money to get these procedures done, you want to protect that investment with a good skincare regimen. And there's actually evidence from clinical data and clinical studies that really do have support for what is a good topical regimen to be on to help correct fine lines and wrinkles and dyspigmentation, which are irregular brown spots on the face that occur with UV. That have been shown to have a lot of benefit. And I found a lot of patients get really bogged down because between online, shopping and the mall, there's a lot of products out there. It's a big industry. And so having the, knowledge of what works, what doesn't work, what will work specifically for you, is something that I found a lot of patients benefit from. And that is completely non-invasive. It's a really topical therapy that helps to correct the problems we see with aging.
We've talked about aging here this morning on Indiana in the Morning. I would assume that some of these treatments would also work for people, for instance, with acne scarring, with other skin conditions, scarring as a whole from an injury, those sorts of things.
Correct. I see a lot of patients who've had a fall or have a scar they don't like, or have had acne is very common, and that can leave behind scarring. So there are things we can do to help correct that as well.
And you'll be able to fill them in on that at this event?
Absolutely, yes.
All right. It's coming up January 23rd, 357-8088 is the phone number to call. 6 p.m., correct?
6 p.m., yes.
At the Park Inn by Radisson here in Indiana.
Yes.
All right. So give me a couple of moments here to talk about wintertime skincare, because people are dealing with it right now. We've got the effects of the sun bouncing off that white snow. That's certainly something that is going to affect us from a UV standpoint. Overall dryness of the air and how that affects your skin. What should we be doing for our skin here in the wintertime?
Well, definitely sun protection is very important in the wintertime. When I tell patients that, in these winter months, I hear gasp from that too. Why do they need to wear sunscreen? But as you said, it does reflect off ice and snow, which can actually increase the amount of UV that your body sees. So year-round sun protection, just like you would in the summertime. And then from the air is much colder and drier. That can really make things like dry skin, various forms of eczema flare up in the wintertime. So, doing your dry skin care, which I talk to patients at length about, including, shorter, cooler showers, using a sensitive skin soap, and then frequent emoliation with the good moisturizer are keys to protecting yourself from the cold, dry air and preventing flares of eczema or dry skin.
Yeah, when you have that dry, I take off my socks at the end of the day, and they're speckled white because of the dry skin of the wintertime. And that, then people say, boy, it itches now. Are there certain soaps that are better for using in dry skin times?
Yes, my favorite is Dove for sensitive skin. I found that is hypoallergenic, very sensitive, very hydrating as well, and also cleans off a lot of the allergens and irritants that develop throughout the day. So a lot of people come to me saying they only shower a few times a week or they don't use soap in the wintertime, but that can actually also worsen eczema because there's a lot of pollution, irritants, allergens that build up on our skin throughout the day that do need to be cleaned off. It's really kind of how you bathe and how you moisturize your skin, which is more important than kind of the frequency of bathing.
I assume the scalp, of course, and shampoos would be affected in the wintertime as well, and we should watch out what products we're using on our heads.
Absolutely.
All right. Well, there you go. It's just we diverted into some wintertime talk here with Dr. Qureshi. I figured I had him here, and people were wondering. They're probably sitting there right now scratching because we started talking about it, but they'll have to deal with that, and you certainly have helped us to understand that. Okay, so one more time, let's talk about the event. It is called New Year, New You, and it's on January 23rd.
At 6 p.m. at the Park Inn by Radisson in Indiana.
Give a call to 357-8088. Make sure that you have a seat reserved for that event. Now, is it only by reservation, or can you just show up?
You can just show up.
Okay.
It's nice to reserve your seat to guarantee that you have a place to sit, but you can just show up that night.
All right. Beautiful. Thanks so much for coming in. We appreciate it.
Yeah, thank you for having me. I'm happy to be here.
Our pleasure. It is Indiana in the Morning, presented as always by First Commonwealth Bank here on WCCS AM 1160, FM 101.